All right, everybody. Hi, good morning, good afternoon, and good evening. I want to welcome you to our special webinar to mark World Day for Safety and Health at Work. It's co-hosted by Wiego, which is Women in Informal Employment, Globalizing and Organizing, and Workplace Health Without Borders. My name is Lisa Seolin. I am with WHWB International, and I am an assistant professor in the teaching stream with the Dalai Lama School of Public Health at the University of Toronto. Where I also teach a course in climate change and health, which is very near and dear to my heart. For those of you that are not, next slide, please, Christy. For those of you that are not familiar with WHWB, we are an international nonprofit founded in 2011 to address the global gap in occupational health and safety knowledge and capacity around the world. It is estimated that over 2.78 million workers die each year from workplace causes. When we look at global environmental burden of disease, we know that in low and low medium income countries, occupational environmental risk factors account for 14 to 17% of all disability adjusted life years lost. This is far higher than in mid and high income countries. These values don't fully include the factors attributable to climate change. Next slide, please, Christy. The warming climate is bringing about geophysical changes to our environment, and these include extreme heat, heavy rainfall and frequent flooding, drought, fires, and the effects on our ocean, including sea level rise. These in turn will have impacts on the way we live, access food, water, housing, energy, and work, all of which are key determinants of human health. Next slide, please, Christy. In the case of work, just looking at warming alone, many parts of the world are and will increasingly continue to experience extreme heat and humidity under current emission scenarios. In some cases, these hot and humid conditions will exceed the threshold for human survivability in the absence of air conditioning. Workers are particularly vulnerable to these effects due to their increased exposure at work and their elevated metabolic heat production due to physical work, as well as their lack of agency, their ability to do things like take breaks, rest, drink water, and recover from the effects of heat. Next slide, Christy. So heat will be a significant factor as the world warms, particularly in tropical regions experiencing extreme heat and high humidity. Informal workers, who we will be hearing from today, are even more vulnerable. Climate change will only serve as a threat multiplier to many of the challenges they already face and will add more challenges. And we will learn about this today. WHWB is proud to co-host this session to mark World Day for Safety and Health at Work. And we will be hearing from work regions that are and will continue to be affected by climate change, including Brazil, Zimbabwe, and India. So I welcome you all, and I'd like to introduce Christy Braham from Wiego, who will introduce our speakers. Over to you, Christy.
Hi, everyone. So thank you very much, Lisa, and thank you all for joining us here today. So my name is Christy. I am the Workers' Health Coordinator at Wiego, as Lisa kindly just mentioned. So let me just talk a little bit about Wiego and informal economy. I'm not sure how familiar people are here, but I thought I'll give a little background. So Wiego is a global network of researchers, development practitioners, and workers working within the informal economy. We have our network is spread out across 40 countries, particularly across Asia, Latin America, and Africa. And we work with 4 key groups of workers in the informal economy. So this includes waste pickers and reclaimers, street and market vendors, domestic workers, and home-based workers. So of course, the informal economy is much bigger and much more diverse. There are many people that make it up, but we deal with these 4 very broad groups, which already includes many hundreds of millions of workers. So how big is the informal economy? So looking at this map, it becomes pretty clear that the informal economy is very much the norm. The global majority of workers on our planet are actually informally employed. If you look at the 89% in sub-Saharan Africa, look at the 88% in South Asia. So really we're talking about the global majority, and they comprise over 2 billion of us on our planet. And furthermore, the informal economy is growing. It's not going anywhere. It's becoming more and more prominent. And so this is truly a hot topic. And this idea of climate change and occupational health and safety and informality is really key for us to really grapple with. So just quickly, so workers in informal employment are exposed to a range of risks in the workplace, whether you're working in the landfill, whether you're working as a domestic worker in a private home, caring for children, caring for older people, cleaning, etc. And yet workers face these risks and are very unprotected from these risks in the workplace. And the reason why this is the case is because occupational health and safety laws and frameworks, where they do exist, often do not cover workers. So informal employment is outside of a formal employment relationship. It's not a standard employer-employee system. So they're not captured by those occupational health and safety laws and frameworks when they exist. Working in urban spaces is not fully regulated, as again, they're outside of formal workplaces like offices or factories. And the location of the workplace can determine, unfortunately, their access to health and safety provisions, whether that's access to water and sanitation, whether that's access to personal protective equipment. And this means that workers are often forced, they're often forced to become self-reliant. So no one will help workers to access these provisions. Workers have to pay for access to these things themselves. And many workers actually face incredible income insecurity as it is. So this is a huge burden, unfortunately, that the workers have to face every day. And furthermore, workers in informal employment are themselves agents of environmental sustainability. This is just a snapshot from Wiego's emissions calculator, which is available on our website, where my colleagues calculated that waste workers are helping us to avoid emissions, whether that's from energy intensive sorting or from open burning. So informal workers are so key to to the energy transition. They're so key to the fight against climate change, and yet they are especially vulnerable to climate and health risks themselves. So I am going to stop sharing. So this was our introduction to the webinar. I am now going to move on to our first speaker, who will be Dr. Sonia Diaz. So just to introduce Sonia, so Dr. Sonia Diaz has been Wiego's resident waste specialist since 2008, and is a sociologist by training, and often refers to herself as a garbologist, with a specialization in solid waste management. And she's been very active in the waste management field in Brazil since 1985, with a focus on promoting integration of social inclusion aspects into the technical planning of waste collection and recycling, gender and occupational health. And of course, Sonia is also a board member of Workplace Health Without Borders as well. So we're really, really happy to have Sonia with us today. So welcome, Sonia. Let's share your slides.
It's a pleasure to be here and host this first joint webinar with Whwb, Wiego and Whwb, and to talk about such an important thing. And next slide, please. We are going to share some kind of exploratory, preliminary findings of exploratory research that we are doing. So bear with us because we have just finished our field work and we are going through the wealth of data we collected. And so what I'm going to share are very preliminary. We have two members of our team here today, Ana Carolina Algando and Juliana Gonçalves. Welcome. So when we started to think about climate change and waste speakers, we conducted our literature review for the project. And for us, it was very clear, that there is very limited empirical evidence of the relationship between waste speaking activities and climate change causes and impacts. And I think partially this is because there is kind of a limited awareness of climate change discourse and language among the waste speakers, at least here in Brazil. And even though waste speakers are those who are contributing to mitigation of climate change, right? So for us was very clear the need to understand what were the perceptions of workers, both cooperative members and non-organized workers, in terms of knowledge on climate change. And we also wanted to start building a kind of our baseline about the impacts of climate change in the workspace primarily, but also at home and in urban spaces. And we wanted to understand what kind of adaptation were workers already implementing, and also the different forms of support or lack of support that they received during climate change, extreme climate change events, and what was needed from their perspective in terms of to improve their ability to better adapt, in terms of what they needed from their own national movement, because waste speakers in Brazil have a national movement of cooperatives, and also from government and other actors. The next slide, please. So we started this qualitative and quantitative research. We had a national survey, a small sample, but covering all regions, mainly all regions in Brazil, 23 regions in Brazil. We conducted focus group discussions in the metropolitan area of my city, Belo Horizonte, where our team, Wiego Brazil team, is housed. And we also conducted key informant interviews with national leaders of waste speakers and with city officers of 3 cities that we are doing a deep dive in climate change and urban issues, which are the cities of Belo Horizonte, Salvador, and Manaus. So for us, this mapping is important because it is a tool for political influence of waste speakers around infrastructure and around urban health systems that can help workers cope with climate change events and impacts. And also it's important because it can help build workers' knowledge and preparedness related to adaptation and coping strategies. Next slide, please. I'm going to go over very briefly, giving you some highlights of the survey and focus group discussion. So our survey, we covered aspects related to demographics, to work history, to the perceptions and knowledge on climate change, what kind of climate change events that workers reported in terms of their workplace primarily, but also open to other, at home and urban spaces. And we also probed on what were the coping strategies and the sources of support that waste speakers received or not received, and asked what were their recommendations for additional support and information. And we are teasing out differentiated impacts by cooperatives, cooperative waste speakers versus autonomous or non-organized waste speakers, and also gender, race, age, and place of work. Next slide, please. So very briefly, here is a, is a small n, but we covered many regions in the country. The next slide, please. We have, in terms of gender breakout, 58% of the workers in our survey were female workers versus 42% male. And we have vast, a majority of Black people and also brown in terms of race. Next one, please. We highlighted here two kind of impacts that came across a bit more heavily on our survey. Waste speakers were reporting about facing a lot of issues around heat stress and floods. The next slide, please. And in terms of coping strategies, they have been, in terms of floods, they are kind of improvising their workspace to cope with floods. They have started, they have used equipments, different equipments and other strategies to cope with issues regarding to floods at work. And in terms of heat stress, which is something that, it's something that we have to highlight, that the workspace of waste speakers in general, they are very improvised, and they often reported issues. I've worked in this field for 4 decades nearly, and it's, the insalubrious workspaces make heat a very strong problem. So, but heat stress came up, very strongly. And waste speakers are changing working hours. They are trying to, when they can, use light clothes, and sometimes they have to stop working. And if they are lucky enough to, in the case of those who have sorting spaces, to have access to, a sorting center, they may refresh themselves, by using water to cool their body temperature. Next one, please.
Sorry, Sonia, just one more minute.
Okay, so they have been having support for governments and both industries. Next, please. And in our focus group discussions, again, heat and flooding came up very heavily. And, they reported exhaustion, disruption in production, food security issues, and equipment failure. And in terms of coping strategies, they went through in details in terms of the kind of improvised adaptation they are starting to do into the sorting centers, and the way that they are trying to reorganize their work routines and space, and how they have been proactive in terms of trying to fundraise for coolers and for water fountains, and also to be engaged in demanding municipalities and allies for support. Next one, please. So very key takeaways for us, looking at our sample and focus groups, it's very clear a fragmented understanding about climate change, the difficulty in understanding terms such as adaptation and mitigation, impacts on earnings, productivity, and health and mobility. It's something that is very clear for us. In terms of their coping strategies, they have been more often doing improvisations in their work routine. And the groups that are more affected by climate change events have been those that are non-organized, because the cooperative workers, they have kind of in a way, the cooperative functions as a kind of safety net, enabling them to have a sorting center and to have, broader allies that they can turn to in terms of support. And we have also found out that in terms of support received, again, cooperative workers are those who have received more support, and autonomous workers are there to fend for themselves. Next slide, please. So this is my final slide. I think in terms of thinking about what it takes for climate change action based on what we have seen, for us, it's very important that comprehensive awareness building programs are designed for waste speakers and policymakers, because we need to build awareness amongst waste speakers in terms of what climate change is, in terms of how to cope with the impact so that we can build a resilience, but we also need to involve policymakers, that they are aware of what is happening in this field and what they can do to support workers. We need to work on more climate change sensitive health systems and help the workers to learn how they can take care of themselves individually and also as a collective, so that they can have, tackle issues like food security, self-care strategies to cope with heat stress, and what are the appropriate health and safety measures that need to be in place for them to build resilience. We need to invest on research, more systematic climate change impacts mapping on waste speakers. It's very important so that we can document this systematically to inform policies and contribute to a just transition to climate change resilient systems that are evidence-based. We need to help workers access investment for climate change sensitive smart infrastructure that needs to cope both with heat stress and with floods. So we need to be smart in what it takes in terms of retrofitting existing infrastructure or building new ones. And we need to invest on cross-city learning exchange involving workers and also policymakers, that we can frame issues like workers' health and work conditions. So I end here. I think we need to really build a climate discourse that starts from the waste management experiences of waste speakers in urban environments. Thank you very much.
Thank you so much, Sonia. And thank you also for the final slide with those very clear call to action for all of us. So now we're going to move from Brazil to another context. We're going to go to India now, and we're going to hear from Kanu. So Kanu Priya Kotiwal is a researcher with Urban Health Resource Center, which is a voluntary organization focusing on improving health and well-being of urban poor in slums through building capacity of and mentoring slum-based women's groups in Indian cities. At UHRC, Kanu Priya engages in action research and program implementation with slum communities, focusing on building resilience against climate change and other well-being challenges in the last 5 years. She is a sociologist by academic training, with an interest in understanding multiple deprivations linked to urban poverty. Kanu, the floor is yours.
Thank you very much, Christy. I hope I'm audible and my slides are visible. Okay,
they are.
Thank you so much. Yeah. Good evening, everyone from India. I am Kanu Priya, Research Associate at Urban Health Resource Center, India. The India presentation is going to focus on climate change and occupational health risks of informal workers of Indore, a city of 4 million in central India. So before I start with my presentation, here are 2 facts that we must be knowing about certain rosy pretensions of India's growing economy, that it is estimated by 2030 that India will be contributing to 70 to 75% of country's GDP, which is a report by Barclays. And close to 90% of India's workers are engaged in informal sector, despite the growing number of millennials. This research entailed 90 qualitative in-person interviews with informal workers and 20 key informal interviews in Indore. We interviewed factory workers, casual laborers working on construction sites, and engaged in peri-urban agriculture, street vendors, domestic workers, women working from home, and slum youth in the age group of 18 to 26, with a sample of 15 each. Heat stress owing to increased temperatures had a significant impact on the health and livelihoods of informal workers, particularly factory workers and casual laborers, as owing to their limited agency, they cannot practice adaptation. Factory workers often working close to hot furnaces and heat emitting machines where protective gear like masks and gloves reported that this increased heat stress. As we can see in one of these pictures of a factory worker working in a chips factory, that he's working close to a hot furnace. Peri-urban agriculture workers are also vulnerable to heat stress as they work under the hot sun. Another picture of a peri-urban casual laborer who is plucking flowers in an afternoon heat. Their coping mechanisms such as drinking more water, taking breaks, wetting arms and face have challenges as managers' pressures would often prevent factory workers and casual workers from taking so many frequent breaks. Heavy downpour owing to intense rains was another challenge that was reported by informal workers, where street vendors, casual construction workers, and domestic workers faced challenges owing to heavy rains. Construction laborers who are mostly out of work during the rainy season, as rainwater damages the cement and sand. There is also a greater likelihood of accidents on slippery surfaces. Street vendors who sell perishable items like vegetables, snacks, and spices risk damage of their merchandise. There is also lower customer turnout owing to waterlogged streets. We can see in one of these pictures of a waterlogged street where a worker is wading through. Domestic workers commute through waterlogged streets, but this leads them to getting wet and often falling sick since their workplaces tend to be far from their settlements. And if they take a day off, that results in wage loss. Factory workers remain at risk due to sharp and blunt implements as well as burns owing to furnaces. This is in terms of occupational health and safety, where risk of injuries and musculoskeletal pain was reported by informal workers. Casual workers such as drilling typically involves dust being emitted, resulting in irritation of eyes and nostrils. Peri-urban agriculture workers working in agricultural fields reported risk of injuries from thorns and pricks. Workers were also at the risk of developing musculoskeletal pain owing to long hours of standing or carrying heavy loads. We can see in one of these pictures where a worker is loading bricks on a construction site, and their treatment mostly depended on managers' goodwill since there are no structural reforms that entail treatment in the event of injuries for informal workers. We also uncovered some gendered burdens of women informal workers as they faced additional risks of workplace injuries and musculoskeletal stress. Since many women were engaged in lower skilled roles than men and hence were at a greater risk of injury, for example, beating of plastic in recycling factories. This is a picture of a woman who is beating plastic in a recycling factory, and therefore she reported that she often is at risk of having injury. Women reported exhaustion owing to additional burden of domestic chores in which they received minimal help from family members. Women reported backache, which reduced productivity and was found to be more common among women with a higher number of pregnancies. This often indicates a medical condition called osteomalacia. Certain emerging and potential solutions that we were all able to collaboratively come up with during the project time frame was that the UHRC was able to facilitate applications for 739 applications of e-Shram card. The e-Shram card is a Government of India's social security initiative to provide insurance for accidents online. However, 736 received their e-Shram cards, and we do not know when they are going to receive the benefits since this is a new initiative. the workers express the need to access ESI, which is the employee state insurance, to enable free healthcare for themselves and families. However, we also learned that workplace managers treat ESI as a liability and try to circumvent ESI by hiring them informally. We recommend that India's Labour Ministry should consider medical care for factory workers not enrolled in ESI up to a certain level. Protective gloves and aprons need to be provided in factories with hot liquids and equipment, such as those entailing the use of oil. And municipal corporation needs to invest in climate resilient infrastructure in slums, since many of these workplaces tend to be part of these slums and informal settlements. Therefore, we need better investment in terms of climate resilient infrastructure in slums and informal settlements. Thank you so much, and I look forward to any questions.
Thank you so much, Kanu, and also thank you for mentioning the gendered impact as well, and the predicament of domestic workers. And actually, in fact, this is something that we have found through our discussions with the International Domestic Workers Federation. So it's really good that you highlighted that. I just wanted to quickly, before we move on to the next speaker, I just wanted to quickly just mention that if anyone here has any questions that they would like to ask during the Q&A session, please put them in the chat and we will keep a record of those, and then we can address them during the Q&A session. Okay, so now we're going to move away from India to Zimbabwe. So I would love to introduce to you Artwell Kandugure, and I believe Wisborne isn't here, but Artwell is a Zimbabwean researcher at Training and Research Support Center, and he has been the lead coordinator of the organization's community-based research and training program, has implemented research and training on various aspects of public health at local, district, and national level in Zimbabwe, and is participating in international research consortia on performance-based financing, climate change, informal economies, smoking and health, in cooperation with institutions in the UK, India, Mozambique, and Canada. So I would love to welcome Artwell. The floor is yours.
Thank you so much, Christy, and greetings to everyone. I hope I'm audible. To confirm, shall I share my screen? Shall I project my slides from this end?
Yes, please, Artwell. And just to interrupt you, I just noted that Wisborne is in fact here. So welcome, Wisborne. And I just want to very quickly introduce Wisborne, who is the Secretary General of Zimbabwe Chamber of Informal Economy Associations. Oh, just lost my screen. He joined the association as a member in 2002 when it was founded. He is a Global Labour University and Reagan Fiscal Foundation NED Fellowship alumni, and he is also an executive member of the International Federation of Workers' Education Association. So welcome to both of you, Artwell and Wisborne. We're going to hear a lovely joint presentation from both Artwell and Wisborne talking about informality, climate, and health in Zimbabwe. So the floor is yours, both of you.
All right, thank you so much, Christy. I will quickly share my reflections on the work that we have been implementing in Zimbabwe on climate change and health in the informal sector. I'm just trying to make sure that my screen is projecting well. So just a moment here.
We see it well.
Are you able to see what's on my slides? Okay,
yes.
Okay, all right, that's fine. So our work in Zimbabwe was within a project on responding to climate change in the informal sector in Zimbabwe, trying to understand health and climate change in the informal sector. The work was implemented in Harare, which is the capital city of Zimbabwe, and in Masvingo. Masvingo is situated along one of the major north-south transport and trade corridors in Southern Africa, but it's a smaller city, a smaller urban city. So broadly, the work aimed to understand better the health determinants and health outcomes of informal sector workers, and also the impacts of extreme weather and climate change within these workers. And we also aimed to sort of understand some of the responses that are being implemented within this sector, but primarily focusing on the urban informal sector, agricultural workers, and plastic waste collectors. Then in terms of the methods that we employed, we basically used mixed methods within an action research design. In other words, we combined methods from our literature review, a survey, focus group discussions, as well as key informant interviews, and also conducted some feedback and consultation meetings at the local authority level, as well as the national level. In terms of our findings around the risks and hazards the informal workers were facing, I think they are not new. Some of them have long been documented. In terms of some positive features within the work environment or informal work environment, we found some form of financial support and some technical support from government agencies and non-governmental organizations, particularly for waste pickers. But we found a major gap around lack of social and legal status, which was increasing the informal workers' susceptibility to poor health, injury, and illness. As already highlighted by other speakers, workers were working in the open, exposed to harsh weather conditions, and also they had high exposure to risks and hazards arising from their long working hours, them having to travel for long distances in terms of going to pick the waste, and exposure to chemicals, heat, air, and water pollution, and minimum use of protective clothing. And in terms of some of the examples of hazards plastic waste pickers were facing, I think they are shown their injuries from sharp objects, road traffic accidents and fires, and also the chemical risks and the urban agricultural workers around hazards around the economic related factors and so forth. And suffice to say that one of the major issues that arose from these findings relates to the way how the work of waste pickers is seen by others as work that is done by people who are mentally challenged and so forth. So for them, it was dehumanizing. And it also linked to issues around the psychological risks and other aspects. And we also tried to understand in terms of how the health services were organized to respond to some of these unique health needs of informal health workers. And we found major gaps around provision of mental health services, for instance, and the issue of out-of-pocket expenditures, which are high in Zimbabwe. And you are looking at about 25 to 39% out-of-pocket expenditure as a share of total health financing in Zimbabwe over the years. And if you look at the injuries, the impacts of injuries from these hazards, we found out that most of the workers would be out of work for long periods of time, some of them even as high as 13 consecutive days, with direct and indirect consequences in terms of opportunity costs and also the medical costs. And if you look at the issues around shortfalls in the public health systems in terms of medicines, workers had to buy medicines outside the public health system using their own resources. And this then links to issues around the broader issues around formalization, the legal and social protection to manage some of the cost barriers and so forth. And looking at the living conditions, beyond the structural drivers of urban informality, deprivation, and inequalities, which are well documented, the issues of wealth, power, influence, and how that relates to access to resources, for example, like land, we found some positive features in services like electricity and wash, and also housing, like basic infrastructure in some cases that was there, and also use of some safe alternatives. but we found major gaps relating to the functionality of these services, which have been undermined greatly by vandalism and theft. Some of them were of poor quality, non-availability of some of these services in some areas, and use of unsafe alternatives like old shoes for cooking and so forth. And interestingly, around this area, I think most of the impacts from these negative features relates to how women, for example, are affected, and also people with disabilities. And it perhaps connects with the issues around the social and gender-related vulnerabilities in the informal sector, and why we need to pay attention to the debates and also dialogue around the socially determined women's roles in food waste, in food, water, and care, and how these are going to intensify because of climate change and so forth. So we need to be paying attention to that. Some of our findings seem to validate some of these issues. And the climate and extreme weather and environmental conditions were heightening these insecurities around living conditions. In terms of one of the key findings is the overlapping of risks at home and also in the workplace, as exemplified by that quotation, which indicates the multiplicity or the complex nature of the sources of pollution that the workers were experiencing, be it within their living settings or their work environments. And in terms of the climate-related issues, weather and how it was impacting the workers' health and also work, we found some interesting findings around how, for example, extremes of heat were reducing, for example, the efficiency, the working efficiency of the workers, and also issues around flooding, restricting movement, air pollution, having direct impacts for both men and women, but disproportionately for women, for instance, and the other highlighted areas in that table that is shown there. And in terms of the interaction between the environmental factors and also the work environments, that's one of the pictures that is showing where women were cleaning their plastics, but they were using sort of a dam within the local environments for cleaning their plastics, also sort of contaminating the water, but themselves also vulnerable to sort of infection from parasites in the contaminated water. In terms of responses, we found a number of responses at community and household level, and these related to issues around community networks, education, the pooling of resources at household and community level. And in terms of approaches, issues around diversification, integration of systems, building relationships and value addition, and investment in health and education and so forth. But broadly, these approaches were seen as fragmented, inadequate, non-holistic, and therefore not properly coordinated to bring in the desired system-wide impacts in terms of improving informal workers' health. As an example of upcycling of plastic from some of the respondents there, and also climate-proofing agriculture using plastic, for instance, to produce pavers and also recycling aluminum. But perhaps one key question would be whether these technologies that are being used to sort of beneficiate some of the waste are also not themselves also contributing to harming the environment, and how best can climate-sensitive technologies be co-produced to achieve sort of twin benefits in terms of addressing new or emerging sources of environmental pollution. And reflecting on the findings.
Sorry, well, we're a bit short on time. Do you think you could just wrap up relatively quickly so we can just go to response? Thank you, sorry.
In terms of reflecting on these findings, we found out the central role of water and energy, for instance, water being used for having an effect on the other determinants of health, and also being used for coping with extremes of heat, for instance, and also the central role of energy as it affects pollution and also food and other health determinants as well. And in terms of the follow-up actions in Masvingo, for instance, We had some promising approaches around formation of champions teams, which then sort of tried to catalyze in terms of information flows between the community and the local authority level, and also trying to catalyze inclusive planning and delivery of climate-proofed infrastructure and markets, dialogue on local enterprise development, literacy and awareness raising, and also continued engagement, for example, through local authority budgets and so forth. And in terms of the key messages, I think I'll focus on 3, where we are looking at perhaps the need to focus more on measures that are holistic in nature, guided by principles, and also ensuring that the lived experiences of informal workers are also integrated in these sort of processes. And I would like to acknowledge the diverse team members who were involved in the work in Zimbabwe. Thank you.
Thank you very much, Artwell. Wisborne, did you want to give some of your comments while we're on the topic of Zimbabwe?
Greetings to everyone. Thank you very much. I think I'm just going to just give a few comments on what my colleague Artwell has just shared. To say from this research which we did, from our onset, we were just doing the research findings on promoting health and climate change effects, and the resilience of the informal workers. But as part of the research outcomes, it then happened that we managed to create a very strong workable environment between the local authority of Masvingo and the residents of Masvingo, who are informal workers and traders, in the sense that the concept of the research created an environment for the workers in the informal economy to be equal participants in the research, where they're the ones who were looking at the information or identifying the challenges they face in the environment, and also having an assessment of those challenges, and also getting the opportunity to present the same challenges to the local authorities. So that really created a good relationship between the local authorities and the citizens. As we speak to this day, I can confirm that since the research, Masvingo, before the research in Masvingo, they were having water challenges. They were having garbage challenges in the communities. They were having electricity challenges in the communities. They were also having the issue of firewood, trees being cut down unnecessarily in the communities. But after the research findings and the relationship and the communication between now the local authorities and the residents, the water in Masvingo is now clean and is now very much available, almost at 80% level per day. They are also having access to electricity, and the residents are now keeping their communities clean. Masvingo City Council even managed to put in place a new dumping site for the community as an outcome of the research. And now whenever they do their local authority engagement meetings, they invite the members of the informal economy who were part of the research, who are now called the champions team, to come and sit at the table, present the issues they are seeing in the communities for the local authority to address. So this is the relationship which is an outcome of this research. And the last point I may need to highlight is we also managed to have a memorandum of understanding between the informal economy workers in Masvingo and the Masvingo local authority, where now we are developing different initiatives to work together as a collective. Thank you very much.
Thank you so much, Wisborne, and thank you, Artwell, as well. So we're going to move on swiftly to our next speaker, last but certainly not least, Dr. Alice Bedlick. So Alice is a lecturer in social development at the University of Manchester's Global Development Institute. With training in city planning and social policy, she is interested in health equity, climate resilience, and informality. She has partnered closely with urban grassroots organizations in African and Asian cities, and she has written a chapter on public health and sustainable urban features for UN Habitat's flagship World Cities Report 2022. And it's great to have you with us. Please go ahead.
Thank you so much. It's such a pleasure to be here. And I'll be building on these latest presentations from Zimbabwe and India. As I've been putting in the chat, we were all part of a shared project funded by the National Institute for Health Research in the UK. So I will be trying to draw together some threads and give us some future research agendas that I hope we can talk about how we might take forward. And as mentioned, I'm now at the University of Manchester. In a past life, I was at IIED in London. And again, it's wonderful to be drawing on the contributions of our previous speakers. So let me just move forward to, I hope, highlight some things that have come out strongly already, but let me just underscore that climate change impacts, as we've seen, it may include heat stress, flooding, water scarcity, are already posing a range of heavy tolls on informal workers' health and livelihoods. These threats importantly interact with pre-existing challenges, such as the use of unclean energy, hazardous living and working conditions, limited access to social protection, and as we've heard, gender inequitable burdens. But at the same time, we've seen how there have been significant co-produced solutions already emerging, including in India and Zimbabwe, thanks to strategies such as bottom-up mobilization and champions teams, as we've heard in Whwb. We've also talked sort of more broadly about gaps and entry points within the occupational health literature. Recent studies have already sought to promote workers' ability to thrive and recognize the diverse employment patterns globally, including precarious work and informal work. But it's still the case that informal workers' health is poorly understood, including in relation to climate change and climate-related interactions with occupational health risks. And I think this can be due to any number of factors, but I would just highlight here that informal workers are often invisible in government data, and their work sites can be dispersed, temporary, or difficult to access, such as mobile vendors or domestic workers hidden in homes. And we think that it's really important to highlight that only a handful of studies have underscored the centrality of informal workers to the future of work. So we see this as a key entry point for our own sort of cross-cutting points that I'll be making here. And in relation to climate change, we would argue that there's a need to develop inclusive climate change strategies that are contextually appropriate for cities in the Global South that have widespread informalities. And in particular, this should entail multi-scalar strategies in order to foster health, climate resilience, and recognition for informal workers, since any effective climate action will need to be both top-down and bottom-up to address the scale and complexity of need. And this is important that any such interventions be co-developed with informal workers and residents of informal settlements. In terms of research gaps, there's been ample attention to outdoor workers and climate-related risks, but we think it's important to go beyond, say, sector-specific analyses of vendors or home-based workers and consider cross-cutting determinants of health in the informal economy. And we would argue that one of those should, of course, be climate change. So I can't do justice to this somewhat complex diagram, which is from a manuscript that we prepared. I can't cite it yet, but I'll certainly keep you posted once it's been published. But we tried to create a framework drawing on the findings in India and Zimbabwe that would offer a new understanding of climate change and informal workers' health at a more cross-cutting and multi-scalar fashion. So just to highlight a few of the points in this diagram, we argue that beyond individual level risks and work environments, there's a need to understand workers' housing access, such as the location and quality of provision, access to services and infrastructure, and other built environment factors. Since, as we've heard from India and Zimbabwe just now, improved shelter can bolster informal workers' health and livelihoods, including for waste pickers that may be sorting their plastics at home. And there's a crucial need for adequate public transit and road networks, especially as floods can disrupt commutes, including of domestic workers, as we've heard just now. We argue that there's a need to look at other cross-cutting factors, including migration, technology change, and global production networks that shape informal livelihoods across scales. So we hope that this will kind of spur future research. We can't claim to have done all of this in our own research, but we see need for this, and we hope that some of our findings can spur this kind of multi-level analysis and how cross-cutting climate change is within these both working and living conditions. So to take a more action-oriented approach, we also tried to identify entry points that could foster informal workers' health and climate resilience, whether addressing gendered and intersectional inequalities. So on the left, you see the importance of gender-responsive social protection for informal workers, support for networks and of workers and in low-income residents, and importantly, in economic development strategies that can upgrade skills and support climate-resilient livelihoods. When it comes to living and working circumstances, as we heard in Zimbabwe in particular, there's a real need to improve energy access both at the home and the workplace, and our findings consistently highlighted the need for gender-sensitive wash, including at the home and the workplace, particularly in the context of hydration during heat waves. We found in our qualitative research that it was often women that were especially likely to report dehydration, which we think links to gendered norms around access to wash at the home and the workplace. This is a key area for future research. We also identify the need to develop occupational health interventions, including to address heat and extreme weather that recognize their array of constraints and multiple competing priorities. And more generally, we think that municipal climate plans can help to address air pollution, workers' health, shelter-related risks, and importantly, also foster access to universal health coverage. So these are amongst many of the priorities that we think would support health and climate resilience, as well as strengthening workers' livelihoods. Let me just close, next slide, with a few overarching recommendations. As mentioned just now, that gender-sensitive wash at the home and workplace is particularly crucial in the context of climate change. Other priorities would be co-produced occupational health interventions that address multiple risks, so not just heat, but also water scarcity, flooding, and other climate-related hazards. Grassroots organizations, as we've heard, can play a key role in mobilizing informal workers, both to address living and working conditions. And further entry points may include climate-sensitive slum upgrading programs, which has been tried in some instances, but certainly is an area for future intervention. And above all, there's a need for inclusive urban governance and participatory partnerships, including with a focus on improving access to social protection. Finally, this is my last slide. We think that decision makers should be more cognizant of informal workers' major economic contribution and their complex health risks that they face, including from climate change. As we've argued, informal workers live and in some cases work in informal settlements in many instances. So fostering workers' health and resilience may require access to improved housing, tenure security, and clean energy and wash. We argue from a methodological standpoint that future of work discussions can move in new directions that recognize informal workers' complex needs, including by prioritizing participatory action research, as we tried to do in our project here, conduct a focus specifically on qualitative data collection to understand this interplay of risks more fully, and to analyze multi-level processes that shape workers' health, including climate change. And as we've heard throughout this presentations today, although climate change could further entrench urban health inequalities, we think it could also present an opportunity, if seized upon, to improve livelihoods, promote health, and foster more inclusive urban development pathways by taking these multi-sectoral and multi-level approaches. So I'll stop there, and thanks very much for this opportunity.
Wonderful. Thank you so much, Alice. We really appreciate your insights. So before we move on to reflect on what we've heard and to ask questions, we wanted to also treat you to a video with reflections from one of the workers in Brazil who Dr. Sonia Dias works with. So her name, so unfortunately she can't be here today, but we have this video, and we'll be hearing from someone called Marli Beraldo, who is the president of the Acamares Cooperative in Salzedo City in Minas Gerais, Brazil. And Marli is a leader of the, sorry, Sonia, for the Portuguese pronunciation, the leader of the Movimento Nacional dos Catadores de Matéria Reciclável, which is the national movement for waste pickers. So we're now going to share this video, and we really hope you enjoy it.
Ei pessoal, tudo bem com vocês? Meu nome é Marli Beraldo, eu sou catadora da Associação de Catadores de Materiais Recicláveis aqui de Sarzedo. Sarzedo é uma cidade que fica na região metropolitana de Belo Horizonte. Eu vim tratar hoje de um tema que é super importante, mudanças climáticas. Mudanças climáticas, nós catadores, nós fazemos um papel que é mitigar, né? A gente contribui muito a aliviar a questão das mudanças climáticas, né? Quando você faz a destinação correta dos resíduos, deixa de se cortar várias árvores, ajuda o meio ambiente como um todo, cuidado com as águas, né? Nós ajudamos a contribuir no cuidado com as nascentes, né? E hoje a mudança climática, ela afeta muito diretamente no nosso trabalho. Na questão da saúde ocupacional, uma coisa que acontece muito, o aumento da temperatura, né? Aumenta a temperatura corporal, o trabalho é pesado, então isso dificulta muito no dia a dia nosso, né? O que acontece muito é, nós temos passado nos galpões muito adoecimento, até pela questão de infraestrutura mesmo dentro do galpão, né? Esse calor muito grande e a gente com pouca ventilação às vezes, né? Então, assim, isso traz vários desgastes, né? Tem dia que, dependendo da região do país que você está, né? Tem dores de cabeça, dores nas pernas, puxar carrinho na rua, imagina, né? Com o sol muito quente, o ar, né? O desenvolvimento do trabalho braçal, montar carga. Hoje, a maioria das nossas associações, nós somos grande parcela de mulheres, né? Então, vem mulheres com problema de pressão, às vezes dá problema de coração, enfim. A questão do acesso à água com qualidade, né? Saneamento básico, isso é extremamente importante. Então, você pode ter galpão localizado em locais onde não tem o encanamento correto, não tem as condições de trabalho adequadas, né? Então, assim, o Brasil é um país muito grande, um país continental, em cada lugarzinho do cantão desse país tem uma condição que o trabalhador catador se encontra, né? Então a categoria ela é bem afetada na questão das mudanças climáticas, sim. A cada vez que a gente agride o planeta, a gente recebe de volta, né? E quando você está numa situação mais vulnerável, isso com certeza impacta diretamente o trabalho e traz doenças ocupacionais.
But now we've come to the end of hearing various testimonies and research insights from our guests here today, and now we just want to share a few reflections. So I'm going to share my screen very quickly just to share a little about Whego's position in this. So as we've heard from everybody here, we know that workers are particularly vulnerable to climate risks and occupational health risks. And all of this is exacerbated by having very, very poor access to social protection, system-wide social protections. And that crucially includes healthcare as a public good. So I just wanted to share some of the barriers that workers in informal employment tend to face. And this is rather consistent across different contexts. So we know that the workers often have to travel a long way to access clinics. And actually one of the demands of workers that we frequently hear is that, for example, workers working on landfills, they need and want clinics that are located close to their landfills, so that if they're injured, either because they've hurt themselves on sharp equipment, or they've been exposed to medical waste, contaminated waste, then they don't have to travel so far to actually receive care and treatment. We know that when clinics and healthcare facilities are located far away, that comes with a cost as well, which again dips into workers' insecure finances. We know that, quite frankly, systems, including the health system, does not reflect the realities of the working world. So the opening hours of clinics don't necessarily correspond to the typical working day of someone working on in a marketplace, or someone caring for children or cleaning in a private household. We know that just a simple act of accessing healthcare also comes with a loss of income because you're not able to work. And of course, workers do not have social protections such as sick pay, sick leave. So often, accessing healthcare comes with a debt, and it drives people further into poverty. And lastly, there's other vulnerabilities here with workers being on the wrong end of the power dynamic, and of course, many workers face issues with immigration policies as well. So looking at social protection more broadly, one thing is clear from listening to these discussions where we're hearing about workers facing an array of risks, which are only exacerbated by the climate crisis. This only solidifies the argument that we need universal healthcare. I know that Alice picked up on this very well earlier. We need health provision that is truly universal. So it's not, it can't just be about a very narrow set of provisions for a very narrow set of conditions. It has to be comprehensive, and that starts with primary care and empowering and supporting community health workers who are essentially the backbone of health systems, particularly in the global south. We need health services that are affordable for workers. They need to be available for them. They need to be appropriate and reflect the realities of informality as the norm on our planet. And of course, they need to be good quality. We hear so often that workers face stigma and discrimination as a result of the work that they do when they seek healthcare. So we know that waste pickers, for example, have told me that when they're injured in the workplace, and this is actually a set of waste pickers who had experienced, had reported like flooding and the impacts of contamination from that flooding. They then went to seek healthcare, and they were treated really poorly by the healthcare professionals, because when they were saying that they work at a landfill, the perception was that they were dirty and unclean, and we can't. That of course that's unacceptable. So we need to have health services that are good quality and provide good quality care to patients, and that includes being very sensitive to who is walking through your door and being welcoming and inclusive. We know that the predicament of workers is often that they don't have standard employer-employee relationships, so they're excluded from social insurance, which is linked to working for whether it's for a big company or some other size company in the formal sector. But at the same time, they're not poor enough to qualify for social assistance initiatives. So that's why we often call workers in informal employment the missing middle. And so we really need system-wide protections to enable them to be actively included in these systems, so that they will be less vulnerable to climate risks and other risks that come with it that affect their health and well-being. And essentially, we need the governments, the state, and those who those who own capital to take some responsibility for these climate and health risks when these are not the fault of workers. And finally, when it comes to acute climate crises, so for example, a flood or a heat wave or a landslide or something like that, another social protection measure could be to supplement the incomes of those workers who've been impacted, of those workers and their communities who've been impacted. But crucially, this must be fully accessible to all. I know that Kanu, in her presentation talking about India, was mentioning governmental initiatives to extend benefits to the informal workforce, and also spoke about how the research center was helping workers to access the eShram card. But yet, these things may exist, but they're not necessarily accessible to workers, and we just need to have these provisions in place that don't exclude but actively include all. And part of that process is having workers being fully actively consulted and participating in the processes of developing these various initiatives, so that they fully represent the realities of workers and actually address their needs. So I just wanted to say that from a Wiego perspective. I'm going to stop sharing. I know that Marianne Levitsky, who is from Workplace Health Without Borders, is going to share some reflections as well. So we'd really like to welcome Marianne. And Marianne is also the person responsible for this webinar, being the lead at Workplace Health Without Borders. So I just also want to thank Marianne for this.
Oh, thank you so much, Christy. Actually, it's very much a team effort at WHWB. But I do want to thank everybody from Wiego who really were the leaders in this workshop, and especially Sonia, who intersects WHWB and Wiego, and Christy for your leadership. Thank you so much for your comments, Christy. I couldn't agree more in terms of the additional health support needed by these workers. And of course, what was striking me from my occupational health hygiene perspective is the opportunities and the need for greater occupational health interventions and expertise. And I think this could be the beginning of some partnership opportunities I'd love to talk to you about. But you know, a few things struck me in terms of the severe occupational hazards faced by the workers that you discussed. Obviously, heat stress is a really important part of it. And in the occupational hygiene world, we are very familiar with dealing with heat stress, and there are standards for heat stress. So one of the things that struck me was, I think one of you said, I think it was Kanu, that employers don't allow workers breaks when they're working under hot conditions. Well, there is an occupational standard for heat stress that says you must have breaks. And there's a sort of very rigid schedule in terms of the level of heat stress and the time that you can work without a break. There's also requirements for hydration and water and other, perhaps cooling centers. So there are industrial hygiene interventions that we are familiar with, and possibly these are standards that are needed in those countries. So in addition to the kind of supports that you mentioned, perhaps getting them to follow international occupational health standards would be a really important thing to add to that. Another part that struck me was the flooding related to climate change and all the hazards associated with that, not just in terms of the water itself, but what it can contain. So disease, mold, often there's a lot of mold growth when things get wet. That's an occupational hazard as well. So there are things that can be done from an occupational hygiene and occupational medicine standpoint to address those issues. And all of this really brings home to me something that Workplace Health Without Borders has been saying for a long time, which is that occupational health has to have greater prominence on the global health agenda, that it tends to fall to the bottom as a global priority. And perhaps the fact that now it's so much integrated with environmental impacts, which certainly have the attention of the world, maybe this is the chance to advocate for much greater priority to occupational hygiene interventions and control and concern. So with that, I think we can maybe open this up now to other people. And Christy, I don't know if you just want to get questions from the chat, or should we allow people to raise their hands and verbally ask questions?
Sure. So I know that Kanu in particular has been very hard at work answering some questions that have been put in the chat during the presentations. I'm not sure if these have been answered already, but I've picked out two that that stood out. So I'm gonna ask them now. So addressed to Kanu. So the project on India. Someone asked are there any potential supports for workers during floods and waterlogged workplaces? So this is specific to the presentation in India. Kanu, I'm not sure if you're able to give some insight on that one.
No, I think I was able to respond to it, but I'll be happy
Okay.
to respond again. Yeah, that there are no structural reforms against climate change when it comes to informal workers in India, because one of the reasons is that climate action plans that are coming up are only very much limited to certain cities in India. So not all Indian cities are under the purview of those climate action plans. There are no legal mandates that one has to follow. These are more like recommendations that how Indian cities can better adapt to climate change. But one of the key weaknesses with these plans is that they are not pro-poor, or they do not cater to the needs of urban poor or informal workers. They in fact do not even recognize that informal workers are the ones that are driving the cities. So it's very important that we need to invest in better climate infrastructure in slums and informal settlements. And I mean, I'm mentioning climate action plans because we feel that that can be an important entry point to do so. So yes, no structural reforms as of yet, but we hope that in the coming years, some reasonable government can come up with something more important for them.
Wonderful. Thank you very much, Kanu. I wonder if there are any questions from the audience that we could take now. You're welcome to raise your hand and ask away.
By the way, I did notice that David Goldsmith had a question in the chat. So it was about asbestos. So David, I don't know if you want to unmute and ask your question verbally.
Thank you very much. And I also would like to compliment all of the speakers. Your presentations were very informative. And my question is this. We know that in India, they are a relatively large consumer of asbestos products, especially related to asbestos cement sheets that are used pretty commonly for dwellings and provide some shade and things like that. The question that I had was, were there any studies or any evaluations of asbestos levels in waste workers in India or informal workers in India? And the reason for asking that is because it is such a serious risk to the health of workers, respiratory health and cancer health. And I wanted to pose that question because it seems to me that in a period of climate change, you're going to have a lot of degradation of these older asbestos cement panels and the replacement when there's been some serious damage, let's say, done to the roofs of buildings and of residences as well. So that was the genesis for my question. Thank you, Marianne.
Does anyone want to respond to the question about asbestos exposure?
Dr. Siddharth, my colleague, would probably be able to respond to this because he's from a public health background.
So, yes, thank you, David, for this question. We've not studied the extent of asbestos exposure systematically, but we have observed that over the last 15 years, there are more structures, whether they're the sheets used on houses or in factories, which are of corrugated iron. So the CI sheets have become more common than asbestos sheets for reasons which I don't fully understand, but we have observed that there are more CI sheets. Perhaps the resale value of CI sheets could have some bearing on why they have become more popular, at least from what we have observed in Indore, where we are doing all this study. So, but asbestos exposure must be happening in various other places. For example, in the shipbreaking industry, there's a lot of asbestos exposure. So it must be happening in many other areas, but Indore is in the middle of the country. There is no sea area close to Indore. And for some reason, over the years, they have transitioned to corrugated iron sheets.
Thank you.
Thank you so much, Siddharth and Kanu. So Rapon was the next hand that I see up, and then we can take a question from Jennifer.
Thank you, Christy. First of all, I like to thank all the speakers for excellent presentations. Actually, it was very informative. My interventions are not really direct to questions, but I want to make some little comments. All the presentation it already highlighted that awareness is very important in the climate action for the informal sectors, and we need to build constantly the awareness of the workers to understand the impact and consequence of the climate change in their life and livelihood. And so that they can have a more position they can build in the personal, community, and organizational life to engage in the social dialogue with government and the local authorities to address the climate-related occupational health risk. Also, the issue of adaptive social protection and just transition for the workers that are very important in the climate actions. And we have been already understood that the informal sector workers are most vulnerable in terms of climate related impacts. And a lot of migrations actually from rural to urban take place because of this, the climate impacts such as drought, river erosions, etc., etc. So these workers actually come to through this migration, come to cities for new life with precarious jobs, and they are faced numerous health and employment exploitations because of this consequence of the impact of the climate change, and that make them so vulnerable. Therefore, we must have to focus on capacity of the workers, on building the capacity and awareness, and also training and retraining of the workers so that in the policy level that kind of access can be created for the workers to get better jobs, decent jobs, environment-friendly jobs, climate-proof jobs. And also we have to have a more research to understand the real impact of the occupational health risks due to climate, because we all know that heat is a very important factor for the outdoor workers, and extensive heat. And IPCC research already identified that a lot of heat-related strokes happen, and workers died in the outdoor works because of in rickshaw pullers, the construction workers, and agriculture workers. They would die because of the heat-related heat strokes. And there are also vector-borne disease, waterborne disease, malarias that are caused because of this climate-related impact. And also due to excessive heat, workers need to work more long hours because to get money to survive. So that also create a over work and over stress to the health, and that has impact. So therefore, we need to build a greater coalitions to build the capacity of the workers to fight in the climate justice for the informal workers, integrate them in the social protection and universal health protection and social protection, employment protection, so that this can be addressed in a very holistic way in the policy framework. Thank you.
Thank you.
Thank you so much, Rapon. Jennifer, would you like to go ahead?
Yes, thank you, Christy. I can't say enough thanks for everyone who has delivered presentations. It's been phenomenal and eye-opening. And I want to let you know that last count, and I stopped early, there were 13 countries represented and 5 continents. So it's been amazing. So thank you all. But my actual comment was directed to David Goldsmith, Dr. Goldsmith. I've been in contact with some people in Ghana, and we can talk about transite. And I have some potential exposure pictures. It is an issue. And I noticed Douglas Mensah was on the call, and I believe he's the one who actually furnished me the pictures, and he's from Ghana. And I do have to add that my thanks to Kevin Hedges, because he came on one of my Ghana class, and talked about his knowledge around asbestos. And so and by the way, Ghana has no regulation around asbestos. So WHWB is working with several people to sort of help them move towards a regulation. But David, you and I, have each other's emails. So if we want to talk more, I'll get off here and just thank everybody. It's been fantastic. Thank you.
And Christy, I don't know if you noticed, but there was a chat several minutes ago from Mansing. I don't know if Mansing is still on the call. The question was, I want to know about PPE, personal protective equipment, for waste pickers in different countries. What standards are used and what should be the minimum requirements? I'm not sure this was directed to one person in particular. Is there anybody who spoke anybody who'd like to answer that?
Yes, if I may, very briefly. I'm not an expert on PPE, but from my 4 decades experience, one thing that we really need to engage with is in research and development in terms of providing waste pickers with appropriate PPEs. They are not designed for informal sector. So we need to really engage in trying to find out how we can really bring this on without imposing PPEs that were not designed for the occupation. The other thing I take the opportunity to raise is that we also perhaps need to engage with how we can support workers, informal workers that are outside the realm of the international standards that we have. This is a key kind of challenge, and something for all of us here interested in OHS to think about and put our creative minds into use. That's all.
Thanks, Sonia. I thought maybe I could mention, and I know Sonia knows this very well, Workplace Health Without Borders has a Waste Workers Occupational Safety and Health Committee that is led by Vanessa Cruvinel, who's in Brazil, and Sonia is a member of that. And in collaboration with that committee, we did have a project about respiratory protection for waste workers in the Brazil sorting facilities, where members of the International Society for Respiratory Protection and WHWB trained people in Brazil, who then went to the waste sorting facilities and in turn trained the workers about proper use of respiratory protection. So I think that is an example of something that can be done. And I know respiratory protection in many informal settings has been something that we have grappled with a lot. It's still a big challenge, and expense is certainly a big challenge. I want to mention something else that Vanessa led in Brazil, because I think it's very relevant to some of the points that were raised by the speakers, which is water, clean water. Like, it's fine to say workers have to hydrate, but if they don't have clean water, they're not going to be able to do that at low risk. And one of the things that Vanessa and her team did was arrange for clay water filters to be distributed at no cost to all the workers in the waste sorting facility. And she got grants from Rotary Club and had these water filters made locally. It was a great example, and I'm sure Vanessa would be delighted to share it with you. And there's some videos about it as well. So if anybody's interested in disseminating that approach, I think it's readily available to look at what was done in Brazil. And I see David is raising his real hand. So if there are not any other virtual hands.
Go ahead, David.
Can I elaborate on something that you just said, Marianne, which I think is extremely important? And also someone in the chat made mention of this too, was that we are having this webinar and it's in English. How can we do a better job, especially around the WHWB community, to get some of the health and safety things that we are talking about translated into other important languages. And this leads me to a second very important issue, which I'm pretty certain is happening in the US right now, but probably there are some other countries that may have some similar kinds of concerns, and that has to do with spring flooding. And I know that there's two major flooding risks right this instant in the United States. One is in the Mississippi River going from Minnesota all the way down to Louisiana. And the second has to do with the flooding in Central California. And the reason for drawing your attention to this is because so many of the impacted workers are likely to be Spanish-speaking workers who will not know about issues related to carbon monoxide from pumps that are not appropriately ventilated, that will not know about the water hazards related to bacteria and other kinds of toxics that may show up in water floods. And we need to be able to speak to these communities in languages that can go out to the workforce in a much more vital way. And I only bring this up because I am certain that the upcoming flooding that we are going to see is going to lead to the loss of life and to illnesses that are fully preventable. And the reason for, again, bringing this up is because I am certain that in other countries, you have some of the same concerns, some of the same problems that may be much more acute for informal workers and farm workers than would be the case for other more established workforces. And I think that these are things that that WHWB should try and play a leading role in, especially as it relates to translating what we know into languages that are consumable, quote unquote, by the communities that we want to try and reach. So let me just end there.
Christy, I don't know if, I know we had scheduled this to go to, well, 11:30 Eastern. We're past that. I'm wondering if we should have a time, ask if our guests are willing to stay to answer more questions, or if other people, I know some people need to leave. You're muted, Christy, by the way.
Sorry. Sure. Yeah, I suppose we can stay on for a little bit longer if everyone's happy. I can see that there's another question here from Kevin Hedges, and then we can perhaps wrap up after.
And there are some questions in the chat. There's some comments and questions in the chat as well.
Okay.
Yeah. So I know I would have to close this meeting on the hour because I need the Zoom platform for something else. Yeah, I think some of us can stay.
I say we take these last two questions. There's just two hands up from Kevin and David, and then we wrap up.
Yeah, it's so I just want to make a comment. At our last webinar, we had Professor Raina McIntyre present. So Raina McIntyre is an epidemiologist, and she also runs a group called EpiWatch from the University of New South Wales. So they do an environmental scan for all the different infectious diseases around the world, and it also looks at the animal burden of infectious disease as well. It's called EpiWatch. I've just provided a a link in the chat box to EpiWatch. People might want to have a look at it, and they provide a weekly brief. So it's a really good international brief of emerging pandemics. So I just wanted to report that, take this opportunity. Thanks, Sonia. That was fabulous.
David, would you like to go ahead?
Thank you. Can you hear me?
Yes.
We should notice a couple of things arising from the Zimbabwe presentation and the India presentation and the work of Wiego. And that is that the research engages beyond the often stated ideal of independence. And it actually involves working with low-income groups to address some of the occupational health and safety hazards they face. And in the indoor study, it went even further. It responded to communities' requests for help to get the ATM cards that gave them access to health insurance and social services. I suppose the other thing that we learned from the Zimbabwe and the India case is how difficult it would be for outsiders to understand that without a strong local research base, deeply knowledgeable of the local context, the local politics, and so on, we risk emphasizing or prioritizing the wrong thing.
Thank you so much, David. Thanks for that comment. I suppose we should probably wrap up now since we've gone over.
Okay.
But thank you so much to everybody for being here. Thank you to our speakers from all over the world, and also Marley, who was in the video, for all of your contributions. Thank you to Lisa and Marianne and everyone else at Workplace Health Without Borders. It's been a pleasure to arrange this event with you, and I really hope that this leads to further engagements with you. And again, thank you so much for inviting us along, and thank you to all the participants here for giving your time, asking questions, and sharing your perspectives and experiences from your context as well. It's been a really, really good hour and a half, well, just over, and I really appreciate the space that we've all created. So thank you so much from me.
And thank you so much, Christy, and to Sonia for initiating this, and to all the speakers. It's been great to talk to you. I hope we do again soon.
Bye.
Bye,
Bye,
thank
everyone.
you.
Thank you all, Whwb and Wiego.
Thank you, such a pleasure.
Alice and Zimbabwe and India for really joining in and accepting the invitation to do this webinar. Thank you.
Thank you so much.
Thank you, Sonia.
Thank you. Bye, everyone.
Bye,
Thank
everybody.
you.
Goodbye. Bye.
Yeah, thank you, Christine. Bye.
Thank you, everybody. Thank you, Wisborne.